Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex, to self-love, to questions about body parts. Let's get this episode started. These questions are going to be sort of a grab bag of pregnancy-related questions. You guys have asked so many wonderful questions about combinations of birth control, how to prevent pregnancy, is this a pregnancy risk? And so I'm going to dedicate these 5 questions to answering some of these random questions. First, how does sperm travel to the egg? And I love this question because there's actually a lot to learn from it. So when a baby is made, it takes a sperm and an egg. And I'm going to start by explaining the egg part of it. So come on in. Alright, this is my rough drawing of the female reproductive system. So here's the uterus up here, and these are ovaries, and then fallopian tubes, cervix, vagina, outside world. So what we call the menstrual cycle involves the shedding of the uterine lining out through the cervix into the vagina and out, and that's your period, okay? What happens then every month is once everything is shed, the uterus builds its own new sort of lining all over again in preparation for maybe making a baby. Now, usually about a week or so after your period is when one of your ovaries, and they kind of rotate whoever's going to release, one of your ovaries releases an egg. So an egg travels through the fallopian tube and into the uterus. Now here is the very important, interesting point, is that an egg only survives for about 12 to 24 hours. So that's really the time that someone can get pregnant, is when that egg is alive. If there is no sperm that is placed into the uterus, then the egg just travels on out and it dies. And then the body kind of starts the process, the menstrual cycle, all over again. Now, even though I said the egg lives for 12 to 24 hours, that doesn't mean that sperm can't come in and prepare a little sooner. So that's where the tricky part comes in. When sperm or semen is introduced to the vagina, it can survive up in this area, sperm, for 3 to 5 days. So this is why it's important to be especially careful with sex leading up to ovulation. Again, that's when the egg is released. And then in about the 5 days prior to ovulation as well. So the reason that we say it's possible to get pregnant at any point in your menstrual cycle is that it's kind of an involved process figuring out when you ovulate. And so if you are just any random person out there who menstruates and you're not totally sure when you ovulate, best to use protection when you have penis to vagina sex. Furthermore, the way that many birth control pills work is that they prevent ovulation, which means there's no egg in here to be fertilized or to meet up with sperm. Basically, kind of answers your question, how does sperm travel to an egg? It goes up through the vagina, through the cervix, into the uterus, and meets up with an egg in the uterus. And when they meet, then that's when they stick to the wall and result in pregnancy. This is a very rough little demo. Wish I had my red pen. Anyway, all right. Question number 2. Can you get pregnant from anal sex? So the most straightforward answer is going to be no. If you ejaculate into an anus, there's no way that the semen and the sperm can get to the vagina, to the egg. The only way that you can really get pregnant is if the semen comes out of the anus and gets to the vagina. So just be careful, wipe up, use a condom to catch that ejaculate, and you shouldn't have to worry about anal sex causing pregnancy. Question number 3. My boyfriend and I had unprotected sex, and soon after I took Plan B. A week later, I had what I think is my period, but it was really light and didn't fill my pad. There were a lot of clots, though. Then my nipples started to hurt. How do I know the difference between implantation bleeding and periods? So this is kind of a complicated question, and I'm just going to answer it in the most straightforward way possible, but in future episodes we can kind of dive into different parts of it. But so when you took Plan B, it probably worked, and that is why you're having this kind of funny clotting, bleeding after, okay? So that would be kind of part one to your question, is that Plan B does cause some weird bleeding. Part two to your question is difference between implantation bleeding and a period. Implantation bleeding, so if the fused sperm and egg like nick a blood vessel while it's being implanted, then that is what implantation bleeding really is, basically. So it's not going to produce that clotting that is more like your uterine lining shedding, like a period. So I would say if there are clots, that's not implantation bleeding. There's kind of a spectrum of what implantation bleeding is versus periods, and just generally speaking, if it lasts for over 2 days and it fills up a pad, that's not implantation bleeding. If it has clots, that's not implantation bleeding generally. So what I suspect your bleeding is, though, is an effect from the Plan B. So question number 4. Can you get pregnant if someone touches your vagina after they touch their penis? So it depends if the penis had semen or sperm on it. If it didn't, then no, there's no way. So if they touch the shaft, if they touch even the head of the penis and there's no sperm, then no, there's nothing to worry about. If there's anything wet or sticky, like pre-cum or actual ejaculate, and then they touch your vagina, yeah, that would be concerning. But if it's just a dry penis, no, it's fine. And then question number 5. If my boyfriend fingered me after peeing, will I get pregnant? So this is interesting because you understand that the pee hole is the shared hole that urine as well as semen come out. And so realistically, to answer your question, no. It is possible that if he ejaculated before he peed, that there would be sperm in his urethra or the pee hole before he peed, but peeing it all out, washing his hands, even just running water over his hands is going to kill any sperm. So to answer your question, peeing and then fingering, no. Even in the most specific of circumstances with ejaculation, then peeing, not washing his hands. If his hands are dry and free of any ejaculate, no, you're not going to get pregnant. All right, so this was kind of a quick little pregnancy grab bag, if you will. And I will look forward to many more wonderful questions. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.